Hi guys, welcome back. I'm Dr. Michael Lee, and today we'll talk about bone loss and why is a bone graft needed. So why does bone loss occur? So bone is kind of like a muscle, and I describe to my patients like this. You stop working out, you're not going to maintain that physical physique that you once had. Same with bone. If you have a missing tooth anywhere in your mouth, the bone's the same exact thing as a muscle. Once there's no stimulation on that particular area, over time, losing a tooth really diminishes the bone width and the bone height. And that can cause some problem in the future if we're trying to place a dental implant. Not only can that affect your dental health, but it can also affect your everyday activities if not treated right away. I see this every day in my practice. A patient loses one teeth and they don't do nothing about that side. Over the years, if they start losing another teeth, they'll do the exact same thing, and it starts being a cascade of events where the bone is just becoming narrower, narrower, narrower. Over time, when you lose multiple teeth, that area is greatly diminished, and that's why we need a bone graft if we're going to place an implant later on in life. If you have one missing teeth or multiple missing teeth and you do nothing about that gap, the bone starts to reabsorb and sink and diminish. But also your teeth in those surrounding places will start to drift. And that causes a big problem with your bite, causes a big problem with your chewing, and it becomes extremely harder down the line if we're trying to do the dental implants or put back those teeth that were missing. When that happens, it does not mean you're not a candidate for dental implants. You're still a candidate for dental implants, but it will require an extra step where we do grow back that foundation of bone. We get that bone back to the shape that's supposed to be in order to house our implant. And I explain to patients all the time that a dental implant is just like a screw that you put in wood. You want that screw to be fully maintained in wood, solid, so that it can support something like a painting or picture or whatever it might be. A dental implant is the exact same thing. When we put a dental implant in there, we want a certain amount of thickness of bone around our implant so that we can hang a tooth over the top of it and to allow you to smile, eat, chew, function. So bone takes about 4 to 6 months in order to grow that foundation back. The process is pretty simple. We go in, we augment that site with bone, we put a membrane over it, and we secure that bone in that site to make sure it does not move. And then we just wait. It's a waiting game. In that time of 4 to 6 months, I'll see you post-operatively to make sure you're doing okay and to check on the healing. And once everything heals, then we can go ahead and put an implant in there and then put your tooth back on. I hope this is informative for you. If you have any questions, feel free to reach me at our social media and give us a call if you have any other questions.